Young and talented, Grace O'Malley Kumar and Barnaby Webber had celebrated their final exams. Here they were heading home in the early morning on June 13th, 2023. But the teenagers would not see the sun rise. As Valdo Calocane hid waiting in an alley, he would also kill 65-year-old Ian Coates. Their killer had a history of psychosis-induced violence. Valdo Calocane had been sectioned 4 times earlier, but when his behaviour became more alarming, he was discharged. Today, a report by the Care Quality Commission found poor decisions and errors by Nottinghamshire's NHS Trust led to Calocane being denied care and the public being denied protection, with devastating consequences.
It is not possible to say that the devastating events of last year would not have taken place had Valdo Calocane received that support, that care, that treatment, that follow-up. What is clear is that the risk he presented to the public was not managed well, and that opportunities to mitigate that risk were missed by the team.
In 2020, Calocane was diagnosed with paranoid schizophrenia and sectioned twice. In 2021, he was sectioned again and assaulted an officer. A year later, an arrest warrant was issued and he was sectioned for a 4th time after attacking his university flatmate. These were the victims of those ignored red flags. After Calocane killed Grace and her friend Barnaby, Ian Coates was next. After stabbing the 65-year-old, Calocane then stole his van and began looking for new targets. Here, he mowed down the first of several pedestrians. Afterwards, this is the moment the police apprehended him. But it should never have gotten this far. By this point, Calocane had stopped attending his mental health appointments and had refused to take his medication. Yet rather than intervene, the NHS treatment team had discharged him. A decision condemned by the families of those he killed.
Valdo Calocane had moments where his mental health waxed and waned. He knew he wasn't taking his medication. He reported he wasn't taking his medication. Mental health professionals knew he wasn't taking his medication. It was a combination of both. It was a combination of a patient not taking their medication, and there was a system like community treatment orders. There were people who just didn't simply do their jobs.
In a statement, Nottinghamshire Healthcare Chief Executive Ifti Majid said, "We acknowledge and accept the conclusions of this report and have significantly improved processes since the review was carried out. Our teams have much more contact with people waiting to be seen and ensure they have an up-to-date risk assessment, even when they are struggling to engage with our services. We have a clear plan to address the issues highlighted."
And I've also ensured that what we've seen in the case of Nottinghamshire results in action right across the country. NHS has already instructed trusts not to discharge patients who don't attend, which is what happened tragically in Valdo Calocane's case. And there will be further action, and I'll be seeking regular updates.
For the families of those killed, not only was Calocane's risk to the public badly managed, but they say his resistance to medication was misrepresented in court.
For us as laymen, I would assume that they've tried medication for him and it's not working and he's that psychotic, it just doesn't work. But we've then found out from the NHS through this CQC report that it wasn't the case of that he was treatment resistant, he just wouldn't take his treatment, he refused it. So they spun that lie really through the courts.
For killing Grace, Barnaby and Ian, Calocane was sentenced to an indefinite hospital order for manslaughter on diminished responsibility. For their families, today's catalogue of errors has come at the highest price.
She played hockey for England. She was very caring and hence wanted to read medicine and become a doctor.
She was my best friend. We're utterly heartbroken that we've lost her.
This is another in a growing number of cases where the system has failed to provide either care or security.
Simeon Brown reporting. Well, joining me now from Leeds is Julian Hendy, the founder of the 100 Families charity, which supports and advocates for those affected by mental health homicides. His own father, Philip, was murdered in 2007. While here in the studio is Dr. Colin King. He's a mental health survivor who's become a practitioner himself. Welcome to both of you. If I can start with you, Julian. I mean, first of all, I'm very sorry about what happened to your father. This must bring some terrible, parallels back to you. Tell us about what happened to Philip, and then has anything since then at all, as far as you can tell, changed in the system?
My father went out to pay his paper bill one Sunday morning in Bristol in 2007, and as he was leaving the shop, he met a man who had a long history of schizophrenia, drug abuse and violence. He was untreated at the time. The man proceeded to stab him in the neck and stab him in the back, and he died 7 days later as I was holding his hand. I am a documentary maker by profession. I ended up making a film about what happened to my dad and 4 other people around the country. I'd found that there had been 20 other cases in Bristol at that time. There had been 4 other inquiries. They had made recommendations and findings. They had found very similar problems to manage the risk properly, problems to look after the care properly, problems to treat drug and alcohol problems, problems about discharge, problems to listen to the families. These are repeated problems that have all been highlighted in inquiry reports for over the last 30 years, and it seems that nobody's actually learning from them effectively.
Why do you think that is?
I hope this is a landmark case which will actually spur on some proper change.
Why do you think people aren't learning from these cases?
I think mental health services are in crisis. I think there's a focus on people on wellness. There's a lack of focus on people with serious mental illness. Most of the cases I see, I've dealt with 300 families, all been bereaved by patient or mental health related homicide. Most of the cases I see are of seriously unwell people who are unable or unwilling to access good care and treatment. The vast majority of people with mental illnesses are never violent if they are in treatment and accepting their medication. The problem is of people who aren't able to get treatment, who don't think they're ill. Those are the cases that need more assertive care and follow-up, and that doesn't seem to be happening at the moment. In Leeds, where I am, we've got an assertive outreach team which has proven to reduce the suicide rate, has kept people engaged in services, and that has kept them, their families and the general public safe. Okay. The problem is those assertive outreach teams have been disbanded around the country, and so the people who don't need it aren't getting timely care and treatment.
All right. Dr. King, you heard what he had to say there, and of course, the numbers are actually quite astonishing. It's 300, so this is not a very, very rare case. Tell us about your own case. You were sectioned 4 times, I gather.
I was sectioned under the Mental Health Act at 17 at Moorshire Hospital. I've been sectioned 17. I've been sectioned 4 times with a diagnosis of schizophrenia. I've been incarcerated, misdiagnosed, illegally treated, subject to coercive practices. The mental health system is almost a criminalisation of mental health needs. It doesn't address individuals. I've got to send a big apologies for those people that have lost their lives in this case as well. The health and safety issues need to be considered much more intensively. But
what you're saying is that when you were sectioned, it was more a form of incarceration than a form of treatment?
Yeah, it's incarceration because, you know, our mental health systems are not being invested in improved since the Poor Lords, and that's the 1600s. Our Mental Health Act is completely out of sync. Our way of working multidisciplinary, from clinicians to nurses to psychologists, the multidisciplinary practice is flawed. And we are in a dangerous situations where people are being badly treated on mental health systems.
And when you were released into the community, when you were discharged, having been sectioned, what was that based on? What were the decisions around that?
They were economic and political. We need your bed, you need to get out. You need to be moved to the community. Even though we haven't got a sustainable care plan to support you, we need that bed. So the decisions are business decisions. They're not based upon person-centred, individualised, holistic approaches to people's needs. And that's where we are at the 2024.
So when the Health Secretary Wes Streeting said in the King's speech, there was this line about we need to reform the system, more rights for individual patients. Is that about basically dealing with backlogs, that they need to make space, a bit like in the prison system?
They need to make space. When you consider that for my community, we're 11 times more likely to be given a diagnosis of schizophrenia. We're more likely to be given medication. We're more likely to be mistreated. And so the mental health doesn't recognise the need to invest in community resources so people can be discharged properly and effectively with clear safety plans that are multidisciplinary orientated.
Julian, if I can turn back to you, I mean, to do this properly, to look at individual cases, requires a huge amount of manpower, but also money, doesn't it?
It does. It's a question of, in my view, it's a question of resources, but also cultural change. I think there's as I said, there's an emphasis on looking at wellness and well-being and not sufficiently looking at serious mental illness. We've lost, in 1970 we had 120,000 psychiatric beds. At the moment we've got less than 18,000, so that psychiatric institutions are not safe places. It seems to me that had we had more places that could actually be a proper place of safety, asylum in the old sense of word, where people could cope and recover from their illness and be helped to do that, or that we don't have those systems. We need a cultural change, it seems to me, to have more assertive care and treatment for those who need it, and we need more transparency around these sorts of cases so we can talk about it easier.
Right, and is there a problem also about the fact that mental health is still stigmatised? It's something that people don't want to talk about, they don't want to confront it, and it's everywhere.
I think there's more mental health awareness around, but I think the problem is that cases like this, violent acts by people who are untreated, cause massive amounts of stigma. So the only way, in my view, to counter the stigma problem is by treating the violence and giving preventative care so people don't go into crisis and commit terrible acts against themselves, their families, or the general public.
Colin, do you agree with that? I mean, again, it seems to be about individual cases, assessing individual cases, but at the same time having a sort of more holistic approach with society as a whole to teach them about mental health, what it means.
We need to educate people about mental health is something that starts with good practices, good wellbeing practices. We need to elevate that safeguarding procedures and duty of care to people in mental health settings. We need to make sure that we invest not from a business model, from an individual model. My good friend, Ajibola Lewis, who lost her son in 2010, had a legislation called the Mental Health Use of Forces Act. She's now struggling to ensure that we have good, comprehensive support from peer support, lived experience practitioners. And
so you've had an amazing recovery yourself. You know, the treatment has worked. You're now, Dr. King, you are actually sectioning people into the system when you have to. But how stigmatized were you? How much was that a burden on you?
It is a massive burden, and it is still a massive burden. When I walk and I'm talking to you in the studios today, my name is Colin King, an individual with status, with prestige, with a history of achievement. When I give my diagnosis, I'm reduced to somebody who has the diagnosis. And we need to look beyond to the person inside the diagnosis and begin to work with people so they retain their humanistic status.
And what can society, what can government do quickly now in order to fix that?
But I know that Tim Kendall is now activating community-orientated projects that are going to be activated on a 74-hour basis throughout the community. They need to actually employ people like myself as lived experience advisors to restructure and dismantle the whole mental health system.
Julian, final word to you briefly. What do you think should be done right now in order to make sure that the kind of suffering that you went through, your father went through, is not repeated?
I think there needs to be wholesale change. I think that we need to focus on assertive care for those who need it. We need a lot more transparency around it. We need reform in the way mental health is dealt with. We need a focus on serious mental illness, not well-being and awareness.
OK. Julian Hendy, Dr. Colin King, thank you very much to both of you.